افتكر كلنا يعني المفروض تكون في ابلوز لاحمد على التوك الجميله دي. انا عملت لي ابلوز هناك صغيره. طيب السيشن الثاني
virtual applause.
virtual applause. Thank you very much. Absolutely.
وصلت يا سارة.
Thank you very much. طيب السيشن الثاني يعني لنا عظيم الشرف وارحب يعني بشده بالزميل العزيز مجدي اسحاق، وبرضه a very helpful talk with ties nicely مع التروما اللي هي resilience. فالريزيلينس بالعربي شنو يا مجدي؟ المرونه. muted يا مجدي.
مشكلتها بالعربي الحقيقيه لانها يعني is very wide، it can't be one word، يعني بتبقى هنا اقرب لانها ممكن تكون المرونه النفسيه اقرب من انها تكون المرونه لوحدها، لانه مرات المرونه في التعامل، المرونه في التخاطب بتكون صعبه بالعربي.
طيب ثانك يو
one single word. كيف اعمل شيرنج يا جماعه؟
طيب ياسر حسن will advise on how we do that، لكن اول حاجه let me introduce you دكتور مجدي اسحاق. بس دكتور مجدي اسحاق consultant psychiatrist educator. يعني we really برضو value contribution حقك و we look forward to hearing a talk دي. we have an hour including a question answer session. over to you. وبعدين ياسر لو بس وريت مجدي how to share السكرين حقتهم.
عملتك كو-هوست رايت ناو. في عين لما تمشي في الزوم هتلاقي حاجه هنا سهم بلون اخضر اسمه شير سكرين. بريس اون ات هيعمل لك انك ممكن تشير يور سكرينز. I think احنا we can see it right now.
You can see it now.
Yeah.
بس لو عملت لنا سلايد شو excellent.
Are we okay now?
تمام. over to you يا مجدي.
أول حاجة السلام عليكم كلكم يا جماعة، وأتمنى إنه نتلاقى يعني في أيام قادمة في بلد آمن وأهلنا كلهم ننعموا بالسلام والمحبة. The resilience is going to be more or less part of what is going through now. And I'm sorry, Sarah, I don't think I would be able to be as good as Ahmed to keep the time, because unfortunately you give me resilience. And resilience is so wide, and for me to be able to grab it all in one session, it will be very difficult, but I will do my best. But I can promise, I will give the highlight of what we are talking about here, and I am going to be, if there is some willings and motives, people are motivated to do separate sessions for people who wanted to be trained in resilience therapy or resilient counseling or resilient coaching. So if people are interested out of this forum, I'm more than happy. We can arrange that. They can contact me and we can elaborate more on what I'm going to try to highlight today. Okay? So when we are talking about resilience, more or less, we are talking about how we are going to deal with stress. And we are talking about a phenomena, which means how to maintain the individual in some form of equilibrium. How we will be able to rebound back at the time of adversity. So we react to stress in different situations, which will affect our normal level of functioning, from emotional, from behavioral side, from all aspects, and affect our performance. So how we will be able to get over that situation and get back to our normal, our basic level of functioning, that is the resilience phenomenon. So generally speaking, when we talk about stress, we are not going to go in any more deeper details about what we mean by stress here, because for everyone has got their own subjective account on what they are talking about when they say stress. We're only going to define is at the time when the pressure exceeds your ability to cope. And that is varies for everyone at any time and at any stage of their life. So you are not here to judge what is the stressful situation for that specific person, but you need to help them to deal with that situation, regardless of what your own interpretation of that level of stress. Generally speaking, after war or during the time of war, everyone would be stressed, either for the war phenomena itself or for the personal impact of the war itself. I'm trying to do today is to try to help you to get some skills to make you useful at this moment of time and to be trained to the basic level who you will be able to use these techniques to help with this situation. Generally speaking, all of us know, just for you as a reminder, when we react to stress, we either will have our physiological changes, emotional changes, cognitive changes, behavioral responses. But the most important things we need to know, we can reach a point of habituation. We can return back to normality without any intervention. So it is the normal phenomena. That is, we have changes and have responses, and these responses would get to the point where it can, by our own internal resources, our own external resources, we can be able to get back into our previous level of functioning. So when we are going to talk about any form of responses, I wanted you to realize that is the response could be more or less have got either voluntary type of approaches or could be an involuntary type of approaches. From a voluntary type of approach, sorry. From the voluntary type of approach, all of us, when we face a stressful situation, I wanted you to, when I'm talking to you, please think about the situation like this. Somebody who has been through the war zone and they lost, say, their house. Make it that way and make that scenario as part of your example when we go through this. So when you go through stress situation, generally speaking, you respond by either your primary response, the survival instinct, to try to control the situation. So you try to modify the problem by itself. And that is, you try to see what has happened, you try to secure your own house, you try to get somebody to sell the house or to protect it. So you will look into the stressful issues itself and you try to deal with it. Secondly, you can look into your own perception, your own cognitive thoughts about what happened to you. Oh, it's not the end of the world. Most likely it will be transient. The issue is going to be resolved sooner. So you will be more or less rationalizing your own situation with some form of control coping. The other type of things, you try to avoid thinking about it, trying to go through denial or through some form of wishful thinking, or trying to block it completely. Oh, this is not happening. I'm sure that is not going to be that bad. It's just something transient. So in a sense, that is why we need to know those type of responses, because when you are assessing your client, you need to know what type of strategies they are using at the time to deal with that stress. So you need to realize, and you can ask them directly, when you talk about the voluntary strategies, you say to them how you feel about what happened to you, what your reaction to what has happened to you. The involuntary, that is something you need to look at it yourself or to ask about it directly to guide you, to find out. You need to find, first of all, if there is any change in personality or change in emotion or change in behavior. You wanted to know if there is any increase of arousal, if there is any level of engagement with his surrounding. Is he distant himself now? Is he more or less avoiding? Is he going to any maladaptive behavior? Is he starting to smoke more or drink or becoming aggressive? So here you have to be careful in when your assessment should be looking into direct questioning for looking for the voluntary strategies, or indirectly you will look for the involuntary, and you ask them specifically, or you ask their friends or relatives or spouse about what is generally their reaction would be. Normally, the situation will help you to identify the severity by trying to explore more about the exposure of the event itself. How far that event mean to them. Somebody who lost his bicycle maybe is more important for somebody who has lost his new car. You need to look into the demographics. You need to know the age process. You need to know what is their social situation, their financial situation. That will help you to understand the severity of the adverse reaction they have been through. You need to explore the psychosocial situation as a whole, the level of support, the level of understanding, the level of people involved into that situation and how much he or they shared with him that adversity. Then you need to explore the current environment. Where is he now? هل هو برا السودان في المعبر مشى في القاهرة قاعد حاج هل هو شغال هو what is happening now? You need to explore all this at the time. Okay. So we got a problem because when we talk about resilience, we have to realize there is two issues here. Resilience is, as we said, it is a normal phenomenon. Either you can use it to treat people, or it is a part of our normal process of developing our own skills. So it's either a treatment, or it is either some form of our personality trait, part of our protection of facing stresses, and part of our developmental. So you are here going to play either the therapist role or the coaching role. And the coaching role will be more focusing on protection and development, more focusing on helping individuals how to steer through the difficulties and the diversities. How can they be able to open up for the new horizon without being stuck on the situation? And the treatment role, you have to look into how to overcome the obstacle itself and recover physiological and psychological and socially from what has happened to them. So, and you can do the two together. And that is the most important things. You need to realize, what am I going to be doing here? As far we understand that is resilience, is everybody has got some level of resilience. Do we need to give them more dose of resilience? Just a matter of training them, coaching them, or they need actually resilience counseling, which is a different level. We need to come and have a look at it, and we talk quickly about both. So let us talk about resilience counseling. What are we talking about resilience counseling? If you assess somebody, we looked into those factors, and you realize that this person actually needs somebody to hold their hand and to take them one step at a time in the way of recovery. And here, I think is you need to know and ask yourself, what will be my goal here? And you need to explain to them what will be your goals. So first of all, you have to face to help them to face the fear of the adversity they have been through. You have to be also help them to adopt some positive resilience behavior, which is seen to be the lacking. You need to look for the social support network and how you can build that and improve if there is not a lot at the time. You need, as part of the resilient behavior, you need to train them on the emotional and the physical side of developing their own positive psychology. And that is how to improve their cognitive processing, how to increase their emotional flexibility and control. You need to help them to find a meaning of their existence apart from being trapped to the past. And you try to foster some form of optimism that tomorrow will be better without selling them any false hopes. So your objectives will be here clearly, and you have to explain to them, look, it's a normal situation. What you have been is your reaction is normal. I am not undermining what you've been through, but there is an issue. We need to work on them together. One is facing the fear of what has happened to you, how we can develop a better coping with what is happening to you, how to help you, to teach you in developing some skills to help you to deal with what you have been through, helping you physiological, psychological, emotional, and how to help you to see some positivity out of this situation. So more or less, you start by setting the goals and objective. What is your first step if you are doing resilience counseling? First of all, ethics. You need to remember that when you are going into that room as a counselor, you are more or less neutral. You are not taking sides in whatever is going on, if it is a war or if it is adversity. And you have got no right to judge, to say, oh, والله الموضوع ما كبير زي ده، أو في ناس مروا بأصعب من كده، أو والحكاية يعني ما في مشكلة. And don't try to give them your own reaction evaluation. What matters, their own evaluation. If you don't agree with them, that is not your area. Ethically, you have to come neutral. If they come to you and say to you, that faction of that fighting part has done this to me, you have got no right to go in details to try to justify or explain or to try to say imkin or no. It's not your role. You have to more or less in tune with their what they are suffering. And if they ask you, what is your opinion? That a lot of time that might ask him, have you seen anything brutal like this? You would say, is definitely what happened to you is not acceptable, but you are not in a position. And what's your opinion about these people? I'm sorry, my opinion, maybe because I will be angry, it might not be the right one. I am not good. I'm not specialized in dealing with those issues. I'm specialized in helping you. But what I know, what has happened to you is not acceptable. And then you move on. Don't allow them to drag you into that. Then it's important to define the caseness of the situation. Are they presented with the picture which fulfill the criteria of a diagnostic psychiatric disorder which might need a treatment? Then this is not yours. Here is not yours. If a PTSD, تمشي لأخونا أحمد إبراهيم, if it is depression, if it is anxiety, whatever, if they fulfill the criteria, that doesn't mean you're not going to work with them. No, but that means you have to at least know what are their main issues at the time. If the caseness of being diagnosed at that assessment, then you have to direct them to where they have to go, and you maintain your role. Then your colleague will start working with them on medication, working with them in other different type of psychotherapy, but you have to liaise with them because it's not a good practice to do the two types of therapy at the same time. Okay, so that means you have to liaise. It's not contraindication, but you need to be careful in what you are doing here because generally. Okay, so then you need to identify here, what are we doing here? Is it a treatment, counseling, or no? This person doesn't need counseling per se, but more or less need to train themselves better in better coping mechanisms to develop a better resilience for the future. And here, that then your role will move from resilience counseling to be resilience coaching, and you are capable of doing both. But you need to identify what are the needs of your patient or your client at that time. You need to identify at the time as well if they are psychologically minded, if they are coming and expecting you to give them medication, or they're expecting you to come and answer their problems, or you might help them themselves to sort out their issues. By this empowerment, you have to explain, no, I am here to help you to be able to deal with these issues from your own point perspective of your own existing skills you have. You reach a decision. It is either resilience counseling or training or coaching. Then you want to decide, am I going to work with this as one-to-one or is it a group? Depend on the individual, how they will be working with the group or not, the sensitivity sometimes of type of stressors they might be concerned about, which they might not be want to share within a group. You make that decision with your client, you make that the right decision. Then you agreed on contract. I will see you on 4 sessions, 6 sessions weekly, and we do that. I expect you to do homework. I expect you to look into your homework and we'll deal with it. And give them a time frame. The philosophy of resilience counseling is not analytical. It is more or less a CBT approach. It is here and now. where the therapist is quite active in the role, interacting, but at the same time is not disempowering, is not taking the lead to the degree that is your patient will become more or less just a listener. So you will start with explaining to them that is what is this therapy is all about. What are the 4 pillars of the therapy? First of all, we depend on your strengths. We are not going to bring anything from outside. And because it is an evidence-based, is because from history, because of from our knowledge that individuals are capable of making change in their life. We do that by exploring your thoughts and your behavior, because by changing your thoughts and your behavior will change the outcome of your reaction to the situation. And getting to the right understanding to the situation will help you to get the right decision and the right behavior. So it is very critical for us to help you to find the accurate thinking process to help you with that. So that is your pillar. If you got those too many, by the way, the slides will be available for you, but as well, I said, we can do more training outside this, okay? So what are the steps we use in resilience counseling? There is 7 steps we need to do, and more or less it is based on the basic CBT approach and philosophy. The basic practical resilience skills which you are going to use in your own therapy or your own counseling process are: 1, understanding the ABC, the adversity, the belief, and the consequences. 2, avoiding traps in thinking, or you can find that is more or less, it is avoiding cognitive distortion, more or less. Detecting iceberg is more or less looking into more deeper rooted source and ideas, more or less like exploring what is behind that cognitive thoughts. Then after that, challenging those thoughts. Then after you challenge the thoughts, how to take them in perspective, rationalize their source and magnitude. Sorry. Then you would go for how to calming and focusing, which is more or less is the process of getting your psychological and physical response to a habituation for a situation, and then getting back into the real life. So those are the 7 steps. We will go through them quickly for you to see what you're going to do with your resilience counseling. ABC, give them the adversity. Lost your house. Believe that is, I have got no assets, no life. Consequences, I'm not going back again to that country. That is how you explore. At that time, you only document the effect of the adversity after you identify the adversity and you identify the belief and identify the consequence of that belief. Because most of the time, people might not be able to pinpoint what are the main issues about what they have stressed about. So identifying the adversity, looking to the thoughts associated with it, and then looking for the consequences to that, you have to document that at the first time and make sure they understand. Don't go for leading question, because you have seen many people have been, and you expect that the reaction would be, or their ideas, and don't show any form of an emotional agreement or disagreement on their consequences. That is not for you. At the time, you will maintain your emotional neutrality. Then I will go quickly, which is, I believe that is most of you will be aware about the cognitive distortion or the thinking traps which we might be worried about. Jumping to conclusion, tunnel vision, magnifying and minimizing, personalizing, externalizing, overgeneralizing, and easily you can. Sorry?
So Ayat, if you can mute your microphone, please. It's okay, Magdi, continue.
Okay, so more or less when we talk in resilient counseling about thinking traps, we are more or less referring to the cognitive distortion in a way or another. So I would like you to be more or less, when you are assessing the individual in front of you, you see how far they will be jumping to conclusion, which is have got more or less arbitrary inference. They have got no justification for them to jump to that conclusion. Tunnel vision, where they look into one only small side of the whole story, magnifying all the negatives, minimizing all the positive, personalizing and putting it all because of me, externalizing as make me more or less as in the spectators, have got no role and unable to do anything, and it's just all coming from outside. Overgeneralizing, make it massive impact on everything in my life. Is not only that issue. And then you would look into that all or nothing thinking. Is all or none. There is no between, there's no spectrum. And disqualifying any evidence which will show them their errorness of their thoughts is more or less is just going through the magnification and minimization. And we will have that a very concrete issue of my thoughts are facts. Because I think about it, that is it. And they have to realize the difference at that time between what is my thoughts are and what are the fact are. And the fact, your thoughts are not a statement of fact. It's more or less your own views, your own thoughts. And that is, you have to identify at this stage, you don't do anything apart from recording. You will notice that is at that in their rehearsal to what happened to them, they always will be referring to it should has, or it must, or it ought. So كان يفترض يحصل كده وكان مفروض يحصل كده وكان with associated with يا ريت لو كنا عملنا كده. And also mind reading and then trying to think about what is going on in the other people's mind and just going to conclusion based on that. That is not a conclusive form of list. That is only a 9-point, which is I wanted you to, as an example, for you to see the errorness of the thought process, which will lead you definitely to an errorness in the behavior and the consequences accordingly. Then we go into not only to see the process of thinking, think about what is the more or less the personality fingerprint. What type of a people they are, the person who is, because what they are showing you, they must show who they are. So somebody might be negative in every aspect in his life. He got more or less paranoid beliefs about a lot of things. What does he think is just a view? He's quite fanatic about it, is fundamental about it. Issues will become deeply rooted. You have to be careful here and try to dissect and understand that. Because at the end of the day here, you will be dealing with somebody who have got a lot of ammunition based on their own psychological makeup, and you need to realize this is where they are coming from. Let us forget about that. So then what you should be doing? You should be, first of all, looking for the ABCs, the adversities, and you look into what is they been thinking and their thought process, and you will see their the consequence. You need to see if there is any real direct link between the adversity and their thought process. There is any link between the thought process and the outcome. Would that mean there will be some form of an errorness, make A not equal to C? And that is by validation, by questioning and by challenging. You challenge the thoughts. You challenge the thoughts. والله أنا فقدت بيتي وأنا بالنسبة لي خلاص فقدت أي شيء وبالنسبة لي ما عندها معنى تاني أنا أرجع. Fair enough. Then we need to look into, is فقدت بيتك means you lost everything? You need to question here, and then you challenge everything compared to my house. Then if that is being questioned, then is there any link between, that means I'm not going back anymore because I have got nothing. Is it true that you have got nothing? If that means then the connection between A and B and C, is it valid? Your role as a counselor, how to help them to break this. How to break this, and this not by lying to them. Even you yourself, if you feel that is they got a valid, strong point, which is you are not able to rationalize and challenge, always advisable is to leave this and to take it for both of you to think about it and rethink about it and come back to the next session. Don't ever fall into you become the patient or the client and he will be the one to direct you to what is the validity and the validation of what is happening to them. So here, stage 4, you challenge the thoughts and the link between A and B and C. Then what is important is you put things into perspective. What is the worst scenario? Determine the likelihood of it, identify the best case scenario, and then determine the most likelihood of it, and identify the solution. I got one of my patients who I have seen yesterday, who she was talking to me about, I'm not going to be moving from this house. It's just a different issue because she got more or less altercation with the neighborhood, and then she moved to another house by the housing association, and then we'll try to help her to see. She said, if I am now going there, nobody will care about me, and I wouldn't be able to make friends, and then I have got no life. So we challenge that on the first stage on adversity and thoughts and outcome. But here I want to put it on perspective. That is the next step. I would say, okay, tell me the worst scenario would be is 100% of people, or say 90% of people who are your new neighborhood will not have a word with you. Yes. And what is the best scenario? Okay, if 80%, let us be, okay, reasonable. Do you think that you might find 10 or 20% of people, do you think they might be nice enough to say hello to you, good morning? And then you would be able here to put the things within perspective. Instead of them become more or less entrapped into the worst case scenario, you telling them and put it within perspective. You put what is the best outcome and what is the worst outcome and what is the most likely solution could be. Are they going to take your house? Are they going to bombard it with the airplane and then they're going to demolish it? That's the worst scenario. Or they're going to more or less repaint it and decorate it and you will go and find everything as it is. Or the most likely, you will go and try and find a lot of windows is broken and a lot of doors are broken. Some of your clothes is being there, not taken away. So the most likely outcome is definitely somewhere in between. And then you would need to negotiate that in a rational way between you and your client. So you will draw your sheet. What's the best? How likely? The worst and the solution, or what is in the middle. Okay? So when we did that, you have work on 2 levels. You work on challenging the thoughts, the negative, the erroneous, and you put things in perspective. Coming to the real life, and then you have got to the last 2 steps you need to work on. One of them is how to help them physiologically and psychologically to be able to restore their own ability, focusing on their own self. You will start with how to develop the habituation. They'll start with the breathing technique, relaxation exercise, emotional control. We'll come to emotional control in a minute when we talk about coaching and training, because it will be helpful as well. The end of conclusion where you would like to end up your therapy or your counseling with them, that they have to start to develop their own technique and they get their own resilience skills in their own pocket. They get it out every time. We are not going to call you to do counseling. You would like to say to them, I wanted you to learn, have more or less a 3 pillar. That is First of all, whenever you are in the dump, say to yourself, that is not true, because, and sit down and write down what is going on. And is it true? It is worth to the degree that you have gotten a life? Secondly, whenever you think about the worst outcome, say to yourself, no, let me see what is the most likely outcome and get to the technique you have done. And then you carry on, okay? And this, by rehearsing and appraising this process, that will be your resilience skills more or less become part of their own day-to-day practice. And they use it because they are not going to use it. How many sessions you would be able to get to that? Are we talking about 4, 6, 8? Resilience counseling has got no specific format for how many sessions, but you try to make it as brief as possible because you're avoiding dispowerment. You wanted them to be able to take that power with them forward. Okay, let us go quickly with the time left for us to go on your coaching role. If somebody is, we need to do more or less of protection and development. So you have to realize that everyone, no one is immune, no one is should not in need of learning more resilient technique. Is more or less, we have to be careful. I'm saying that this is not about age. You have to consider that, or your culture, because you can have that issue that is sometimes where you will find that in some culture, men, they don't believe in that. And they believe that it is more or less is a female thing, and they might not be, or we are old enough that is to be able to deal with these issues ourselves. You need to know that it is a coaching process. You need to be more proactive, and you need to use all the resources available that could help you to make them. I remember one of my patients who has been feeling so low, and he was Irish, and then as part of help him to build his resilience and feeling lonely and isolated. And I said to him, look, you are Irish. When I came here to this country many years ago, one of my friends has given me a cassette for an Irish song. And I listened to it, and it always gives me the energy. And he said, what is the Irish song? I said, okay. And I opened YouTube and I put the Irish song, and I said to him, look, this is the singer, this is the song. And I used to listen to it, and it all the time gives me that pride and strength, how the Irish, when they go to America, and he started to feel so happy that there is something from his culture can give him that energy, which is given to me. And in that sense, I utilized his own culture to help him to develop his resilience. So if here on coaching side, we are not talking about counseling. We talked about the 7 or the 8 basic objectives for resilience counseling. But when we talk about counseling here, it is a set of flexible cognitive, behavioral, and emotional response to acute or chronic adversities, which can be unusual or could be a commonplace, which can be learned. And that's the most important things which we need to work on. The first of all, when you started to work with somebody on the coaching side, you need to say to them, first of all, we need to know what we are doing here. It means something and it is useful. You need to put them with you on the same boat. That what we do, it really matters. Resilience is a positive skill, can be built, but you just need to know how to do it, because you see how many people different from yourself has lost their own house, and the reaction is different. It's not about you being weaker or they are stronger. No, but they have got skills which maybe you might not have, and let us see how can we help you to develop that skill. And that is what is really matter at the time. And so it's more or less you realize here, they are with you on the same boat, and they are more or less talking to you within the same language. You are saying to them, look, you are not different from other people. You are just have got the skills we need to learn how to develop it. Even myself, I have been through situations like this before. Many times I give example of my time when I repeat my 4th year in medical school, and I will tell about how that has shaped my life and how that has helped me to be different. Or when I failed my exam for the MRC psych, how that, and that is sometimes here is more or less like a Rogerian form of a school. There is no restriction of you to use a humanitarian form of approach to get to your client to help in your coaching, because here is not a proper counseling. It is here more or less you are a trainer. So more or less we are talking about how we develop the coping strategies. We need to tell them that is every one of us has got different approach. When we are having a situation, we will have physiological changes, explain to them fight or flight, explain to them how our thought process work, explain to them how our behavior is connected with our thoughts, and explain to them how we can learn to change our thoughts so we can change our behavior, and how that could help, and how we can change our behavior and that could help change our thoughts. And explain to them how that is we do things, some of them intentionally, and sometimes we do it without we realize, and we develop a way, a mechanism, which might not be the right one, and we need to learn. Okay, we will explain to them what are the things which will make people have got that skill, and what we are going to do about it so they can develop the skill. So at least they know what we are. This is the syllabus. These are the subject we are going to look into: emotional regulation, controlling impulses, empathy, optimism, analysis of cause, and self-efficacy. Then we see what can we do about it. Okay. So when we talk about emotional regulation, we have to be able to identify there is 7 possibilities of how people react to stress: denial or avoidance, wishful thinking, disappointment and loss, anger and self-blame, self-control of their feeling and not showing or showing it controllably, distraction or minimization, and expressing and sharing their feelings. So we need to know, first of all, what are the negatives, and they need to recognize it. And why they need to recognize it? Because if you are denying the stress itself, then you are not going to be able to look for an answer. If you are avoiding the stress, you are weakening your psychological muscle, which you need to face it. So at least you will build your ability. If you are living on a wishful thinking, you are expect that you are not going to make a change, and you expect change will come from outside. So more or less, you are looking to those pillars and see where he fall within, and then try to work on each of them so they can get the positive side of that level of emotion and how they can control it. So you got the 7 pillars of denial and avoidance, wishful thinking, disappointment and loss, anger and self-blame, self-control of feeling, distraction or minimization, and then expressing or sharing. As well, you need to know, as well as you are assessing, you are giving them some injection and some vitamins. You give them some capsules of positive emotion. First of all, they need to start to recognize the positive about themselves. And you explore that with them. Because time of low, at the time of stress, people will just be more or less with a negative frame of mind where they don't see the positivity in any aspect of their life. And they need to express this positivity. They need to appreciate what is positive. And then they need to be more or less able to be more mindfulness. With the mindfulness, with all the spiritual part of developing your own inner karma yourself and being able to learn how to deal with your own inner self, that is a skill you need to realize. Then positive rethinking, how to reframe if you got the skills or not, of reframing the situation in a more of a positive way. How we focus on your strengths if we identify some. What are the goals which you have been attained? Oh, you are here, you got your family with you. So do you think that is something positive? I know that is a few people who haven't managed to do that. Do you think it is a positive thing that is you managed to do? So it is a goal you attained. What else? You keep them going. If that's a goal which is attainable, can you work on that? Is it a positive thing to look at? And the last things which is important to get is the act of kindness. They said that is a positive emotion. When you express it in behavior, it doubles. And a negative emotion, when you express it in behavior, it more or less, it reduces to half of your own mental energy. Because at the end of the day, positivity is infectious and it returns back to you in double, and it helps you to cope in a better way. I guess I have to leave that model, which is part of our explanation quickly. Part of the positive skills of coping you need to teach is the problem focused. People will always say to you, oh, I know how to deal with problem solving. But in reality, they are not. You need to sit down with them to explain to them what are the problem solving strategy, what are the pros and cons, what are the proposal, what is your rehearsal, what is your scheme of applying it, how you're going to monitor the outcome, and then you need to know. So that's something you need to work on, which is, we believe, is very important. You need to help them to develop the skills of confrontation and at the same time to avoid avoidance, which is a very important thing as part of training. So what are the strengths of resilience we are more or less hoping to achieve? First of all, we want to achieve self-acceptance, self-belief. Accept the way you are, who you are at the time. You are not just a failure. You are not just somebody who is depressed or displaced. Accept who you are. Believe in yourself, self-belief. How to improve your ability and to deal with frustration. How to put things in perspective. How to be more adaptable to things, how to have a meaning for your life, meaning to what you do. You are not only stuck to what happened to you, it's you got a meaning of what can you do tomorrow. And then humor at the end of the day. Instead of being sadness and being negative all the time, what can we do to make it humor? Okay, quickly, I will just go for the last two slides. Behavior, how to improve the support network. How to improve assertiveness when you agreed on something, you don't be hanged to the past and unable to move on. How to reflect on the past and you be able to make a decision about it, and without being just delayed your decision, worried about and ruminating what is happening. How you are developing small goals, how to create a time management, how can you balance your life and your leisure and life activities as well. How to deal with that. That's part of your coaching process, because that is, if somebody is not looking after their own self, if they're not developing their support network, if they're not able to create a good assertive framework of how to deal with things, they are not able to create small goals to it, they would never be able to move on from the trap of the negativity they are. That's the last slide in how we just going to develop our resilience is more or less teaching skills, providing care and support, set and communicate expectation and being reasonable, more or less positive relationship and bonding, and that all together, that will help us to. The last things I would like to say in summary, there is a famous 7 C's for resilience. They will say it is about competence, about knowing that we are able, we got the skills to deal with the situation, confidence, we are got the skills, and we are confident that this skills is able to help us. We got connection with our social network and support which help us. We got the character, which we have got enough of our own personality to help us to deal with the situation. We can contribute to others, that by helping them, it will help ourselves to develop more coping skills, that all together, it helps us to develop the control, which will be our technique to deal with a future issues and stressors. The last slide, I would say, okay, where we go from here? We go from here. You got a role as a doctor, or you counselor, as a therapist. You will work with them as, first of all, you can look into your own self. How much of resilience I need to build on my own self, because you can develop your own resilience. Then you have got your therapeutic role. You have got people who you identified. You need to work with them on therapeutic counseling. Then you got your own community where you have to develop their own resilience. And this is health promotion work, where every one of you is more than capable of getting 10, 20, 30, 40 where they are, and start to work with them on how to promote resilience, because that is coming from a positive psychology point of view and political psychology. That is all the nation who managed to live aftermath of war. The first step was being able to develop their own community resilience. And we are the one who should be the leader in developing community resilience, in making us capable of being positive about the stress we are in, looking to the future and not to be trapped in the past. And if any one of you is keen about working, creating a network for all our people, for all over the globe, making too many groups for counseling or groups for health promotion in promoting resilience, I am more than happy to be coaching, to be teaching, to be participating, and I will be more than happy to get out of this today's talk that we created one step further in materialize what we learned in a positive way to help our people to get out of that stress. Thank you all, and I think I will leave you my telephone number at the end of the session. If anyone wants to communicate with me directly, if you want to do more of training in that, or to work together in our global work of health promotion in creating resilience to our people. Thank you.
Thank you very much, Magdi. Thank you very much for a very inspiring talk. Yani, lots of positivity and positive energy. It reminds me of the saying, anyway, we may not have a choice about what happens to us, like we have a choice about how we respond to things. I think which encapsulates resilience. Really positive talk. And I will open the floor as if either into comments or questions. So please let me know. I'm looking at the chat box, but also feel free to raise a hand if you want to clarify or to ask Dr. Magdi Ishag something.
Until somebody would like to put a question, can I just say my number is, if people could be able to write it or to put it on the screen, is 447878754502.
Thank you very much.
7878754502 for people who are interested either in deeper training in resilience counseling, or they are interested in developing their own group coaching for people around them for building community resilience.
Thank you very much. Dr. Abdul Ghani, you have your hands up. Please go ahead.
شكرا سارة. شكرا Magdi. Very informative talk. طيب عندي سؤال بس الحقيقة. Who would be the best candidate or the best client to choose who could benefit much from resilience? I don't know يعني is resilience falling as a kind of modified CBT, or it lies midway between CBT and supportive psychotherapy? You mentioned that patients who suffer diagnosed as anxiety or depression or PTSD, they might go to other therapies, which we all know. So who would be the best candidate for resilience counseling or coaching or training? Thank you.
Okay, thank you, Abdelghani. It is important to realize that even patients who are diagnosed and have got the caseness criteria for any psychiatric disorder, still they will benefit from resilience. But if we're putting the priority right, the people who are in need for resilience at this moment of time, who has got no diagnostic criteria or fulfilling the criteria for any type of psychiatric disorder, because the severity of the reaction might require more than just helping with the resilience. Maybe they require more of psychopharmacological intervention or psychoanalytical intervention or other deeper intervention required. So you are right in saying we are going to put resilience counseling. Resilience counseling, although it's based mainly on a CBT approach, but you're right in also it has got some supportive element. But the only criteria you need to be careful about in supportive therapy, you might allow patient for this empowerment because you just only work with them within the level of abilities and you are not working on developing. So if somebody who's got schizophrenia, you recognize their limitation and your support will be more or less geared towards that level of functioning they have. But with resilience counseling, you identify what is the level of functioning and you are helping them to develop and to improve that based on the possibility that their previous level is higher. So we need to be cautious on how much of supportive therapy we're taking, but definitely there is a lot of emphasis on CBT here. Anybody, even if they don't have any specific psychiatric symptoms per se, would benefit from developing resilience, because resilience is a skill. If you don't need it now, it will help you to improve your outcome in the future and help you to deal with any stressful coming in your way.
Thank you so much. So please, thank you, Magdi.
Thank you very much, Magdi. I can't see any comments there. Just want to mention something that resonated with me. واحدة من السيز was connections, connectedness. اللي هي automatically حاجة part of الculture حقتنا. يعني لما نقارن باليو كي هنا نحن عندنا a very strong supportive network من ناحية السوشيال aspect of support to manage يعني adversity وcope يعني. ف interesting إنها it is one of them يعني absolutely أنا found that very interesting.
Very interesting. وأنا حأقول لك very interesting story. في كولومبيا حصل إنه جات جزء من الميليشيات على واحدة من القرى وطلبوا بعضهم عشان يدربون يكونوا مجندين معهم، فرفضوا فقتلوا 10 من الأطفال. بعد 10 سنين وفي خلال ال10 سنين الكوميونتي دي بقت حاسه بالمعاناه بتاعتها، بقوا يوفروا اكلهم مع بعض، ياكلوا مع بعض، يشوفوا مع بعض. فلما جو بعد 10 سنين the same ميليشيا وطلبوا منهم قالوا لهم ان احنا we are becoming a family, if you are going to take one you kill them all. الحصل انها مسجله في النون فايلنت موفمنت استراتيجيز، انه قالوا ده واحد من الامثله اللي بيقول لك انه انت if you unite in a one positive psychology as one unit you will be able to make a change even in front of a gun. فالمره دي قام بتاع الميليشيات قال لهم I'm really sorry I'm not going to kill all the village. فمشى خلاهم. صح نحن عندنا في السودانيين عندنا السوشيال سايد اوف ات، لكن ان احنا محتاجين انها تكون more or less controlled. ان احنا ما عاوزينها just a way of انها ممكن تجي to open the wound and leave it open. We need انه صح نكون عندنا a big network of جلسات الشاي، جلسات العشاء، جلسات اللمة، لكن يكون عندنا الكونسلر who's aware about إنه not allow people to hurt themselves, allow them to develop the connectedness. لأنه is the worst things إنك you open the wound and you're not able to close it. So this gathering, instead of being more or less being زي الجروبات تحت الواسطة الأيام دي ممكن تكون بقت تفتح جروح الناس أكثر من إنها to heal it. فبيبقى الفرق بين أن إحنا that's our role إنه when we have this form of gathering, how to direct it to be a positive psychology of healing, of sharing, of support, not just to open the wound and allow it open and make it wonderful.
Fantastic final message, yeah, Magdi. Thank you very much. والله يعني this has been a very informative and helpful evening. أنا أتمنى إنه كل النواب يستفادوا من التوكس دي، يعني both التوك حقت دكتور مجدي إسحاق on resilience and resilience counseling، ودكتور أحمد إبراهيم on التروما وال PTSD. ده طبعا الأول session لنا فكان 2 hours. Going forward حيكون عندنا weekly دائما حيكون افتكر Sundays حيكون عندنا hourly sessions. فأنا أديكم الهيدز up about tomorrow. عندنا دكتورة سلمى عبد الوهاب she's going to talk about capacity. فبليز برضو حيرسل لكم اللينك. ياسر مشكور حيرسلها around for people to log in at same time tomorrow at 8 o'clock توقيت السودان. Thank you very much يا مجدي. And again هنا warm يعني applause لك أنت ولكل الحضور. And I think this brings us to the end of our session. Thank you very much everyone.
سارة سمحتي لي دقيقة ممكن؟
تفضل دكتور عبد الغني.
معلش شكرا، نكرر شكرنا لأحمد ولمجدي و thank you for sharing this very nice 2 sessions يا سارة. بس just technical questions. أنا عايز بس فرصة إنه أطمئن على الترينيز الشاركونا من السودان لو ممكن في دقيقتين بس، مجاهد أو ياسر أو أي زول من السودان. Just let us know how was it in terms of الشبكة، يعني أي واحد في الشباب موجود من السودان؟
أنا ممكن أتكلم يا دكتور عبد الغني، أنا ما من السودان.
اتفضل يا فتحية.
ترينر وتكلمتي قبل كده وما شاء الله عليكي، عندك شبكة خاصة أنت ظاهر. قاعدين نشوف ناسنا وبعدين ندي فرصة بالتأكيد.
أنا سامعة كويس، أنا سامعة كويس جدا.
يس تفضلي فتحية.
أنا سامعة كويس جدا، كأني قاعدة ألف في محاضرة في قاعة في
ما شاء الله
في الإدريس ولا في أي محل ما بعرف كويس يعني، لكن ما أعرف الناس طبعا البر الخرطوم يعني، لكن مشكلتنا مرات بيكون الشبكة كله ما في.
يس عشان كده عايزين نشوف الليلة يوم الليلة. أنا شايف فيه زي 40 attendance 40 لكن أغلبهم من بر السودان. ناس السودان الترينيز في زول سامعنا؟
الو
تفضل.
ايوه السلام عليكم ورحمه الله.
مرحبا،
انا دكتوره منيره مصطفى البدوي.
اهلا يا دكتوره منيره.
كيف
انت من
والله
وين؟
يعني
في السودان.
نحن في القضارف.
القضارف ايوه كويس. نعم
هاي
ممتاز. ايوه تفضلي.
والله نحن يعني شغالين هنا الشبكه، بس اثناء المحاضرات كانت يعني بتقطع وبتقطع تجي قريب 10 مرات قطعت ورجعت.
اوكي
لكن
أوكي.